A heated political exchange unfolded in South Africa's parliament after Julius Malema criticized the government for what he described as short-term political gestures instead of meaningful improvements to public healthcare. The leader of the Economic Freedom Fighters called on President Cyril Ramaphosa to prioritize a proposal that would allow clinics across the country to operate 24 hours a day, 7 days a week. Malema argued that South Africans need functioning healthcare facilities, not temporary handouts like bread distributions. Here's what happened during the exchange in Parliament. Malema pushes for 24-hour clinics. During the National Assembly's oral question session held at the New Mester Dome, Julius Malema renewed the EFF's call for clinics to operate around the clock. Malema reminded Parliament that the proposal was first introduced in 2018 through a private member's bill submitted by EFF Member of Parliament Susan Dembekwayo. The bill aimed to ensure that public clinics would remain open 24 hours a day, every day of the week, allowing citizens to access medical care at any time. However, the proposal was ultimately rejected by Parliament in 2022, with lawmakers citing concerns about financial feasibility and staffing shortages. Malema argued that despite the rejection of the bill, the need for accessible healthcare remains urgent. According to him, many South Africans are struggling with limited access to healthcare facilities, particularly in rural areas where clinics close early in the evening. He said citizens cannot wait for long-term healthcare reforms while they are already facing illness and poor conditions in the healthcare system. Criticism over bread distribution. Malema's comments were also directed at a recent incident that went viral on social media. The controversy involved a video showing volunteers distributing bread to residents while wearing African National Congress branded clothing. In the video, volunteers could be heard telling residents that the bread distribution was linked to the party, with one person saying, "One loaf, one family, ANC is life." Some critics interpreted the distribution as a political campaign stunt ahead of upcoming local government elections. Malema strongly criticized the practice, arguing that handing out bread does little to address the deeper challenges faced by South Africans. He told Parliament that the government should focus on lasting solutions such as improving healthcare facilities and expanding access to medical services. According to Malema, citizens are looking for real improvements in their daily lives rather than temporary assistance. Malema's challenge to Ramaphosa. During the parliamentary session, Malema directly asked President Ramaphosa whether he would support the EFF's proposal to introduce 24-hour clinics and upgrade major healthcare facilities. He specifically mentioned institutions such as George Mkhari Academic Hospital, Tilidini Hospital. Malema argued that improving such facilities would have a meaningful impact on the lives of ordinary South Africans. He urged the government to act immediately instead of waiting for long-term reforms. Ramaphosa's response. President Cyril Ramaphosa acknowledged that he agreed with the principle behind Malema's proposal. In a moment that drew attention in Parliament, Ramaphosa said that Malema might be pleased to hear that he agreed with him. The president explained that the demand for 24-hour clinic services is something he frequently hears during visits to rural communities. Many residents, he said, complain that when clinics close at night, they are forced to travel long distances to major cities in search of medical care. However, Ramaphosa noted that the challenge is not simply about keeping clinics open. The biggest obstacle, according to the president, is staffing. Clinics cannot operate 24 hours a day without enough nurses, doctors, and medical personnel. Ramaphosa stressed that healthcare facilities must be properly staffed in order to provide safe and effective treatment. Funding challenges in the health sector. The issue is also closely tied to government finances. Ramaphosa explained that South Africa continues to train healthcare professionals, but the government has struggled to employ all of them due to budget constraints. The president said it is common to meet young medical professionals who completed years of training but still struggle to find employment in the public health system. In an effort to address these challenges, Enoch Godongwana recently announced additional funding for the health sector. During the February 25th budget speech, the finance minister revealed that 21.3 billion rand would be allocated over the medium term. The funding is intended to support the hiring of doctors and improve shortages in medical goods and services. The NHI debate. The discussion around healthcare reform also connects to the controversial National Health Insurance Act, commonly known as the NHI. The law aims to create a universal healthcare system that would expand access to medical services across the country. However, the implementation of the NHI has faced legal challenges. President Ramaphosa recently agreed to delay the proclamation of sections of the law until the Constitutional Court of South Africa delivers its judgment on several cases challenging the legislation. The court is expected to hear the matter between May 5th and May 7th, 2026. Despite the legal battle, government officials say preparations for the NHI will continue. Legal challenges to the NHI. One of the groups challenging the law is AfriForum, which has approached the Gauteng High Court seeking to have the NHI declared unconstitutional. The organization argues that the law raises concerns about public participation during its adoption and the potential impact on the healthcare system. Government officials, however, maintain that the goal of the NHI is to strengthen healthcare access and improve service delivery. The debate in Parliament highlights the growing urgency around healthcare reform in South Africa. While political parties disagree on how best to achieve it, the issue of accessible and reliable healthcare services remains a major concern for millions of citizens across the country. As discussions continue around funding, staffing, and the future of the national health insurance system, the question remains whether the country can balance ambitious healthcare reforms with the immediate needs of communities across the nation.